Hello, everybody. Dr. Stephen Walker here, broadcasting live. It's my Tuesday and Thursday night mental health live stream where we talk about that dreaded subject, mental health and mental illness, which is kind of what I'm going to touch on tonight. But tonight I'm going to leave kind of the topic a little bit open to try to get you guys to engage with me about things that are on your mind, things that are affecting you. Hey, Kat, how are you? Going to get to those questions and comments, but I really want, we're going to have guests and we're going to have topics, but I really want these live streams to be about you guys talking about what's on your mind. You've got an hour twice a week to engage with a licensed mental health professional, and I really want you to use that time to talk about what's going on with you. If you have questions about mental illness, if you have questions about things going on in your own life, hey, Angie, if you've got something you want to vent and you just want to process a little bit, hey, Sam, how are you? This is the time to talk about it. Hey, Josie, how's it going? From Jersey, what's up? So yeah, I want this to be tonight. I'm going to just follow up on some questions I was asked in some previous live streams and on YouTube, but I really want this to be more of a Q&A where you guys are, if you've wondered about getting treatment, if you've wondered about what talking to a mental health person is like, this is the time to talk about it. So let me just take care of a little bit of business. Once again, I want to remind everybody, I've started a mental health fund. It's called Help a Human. You can donate into it, and I use 100% of the proceeds to offset costs of treatment for people who don't have coverage. Had to tell someone tonight that we unfortunately are not in their they were a former patient client, and we have subsequently not part of one of their new insurance plan. And I hate doing that. I really do. I really hate not being able to provide my services for people who need it. And somebody might say, well, you should just give away your services, man. And the reality of that is I would love to. I would love to give away my services. I would love to not have to involve money in what I do. But the reality of it is, if someone's going to feed my, where is he? Right here, my 5-year-old, if someone's going to pay our office expenses, if somebody's going to pay our personal, our health insurance plan, if someone's going to pay for me to live without having to charge for my services, I would love to not charge for my services. But unfortunately, we live in a capitalistic, economically based society. So long and short of it is, you have a little extra money, you know somebody that's well off and wants to do something do something good with that, refer them to helpahuman.org, and you can donate directly into the fund. And like I said, 100% of those proceeds go towards, or donations go towards, me providing treatment for people who can't afford it. Okay, so what's on your mind tonight? What's going on? What's happening? What's going on with people? Okay, talk to me. Let's get some dialogue going here. Remember, mental illness, there's nothing to be ashamed of. There's nothing to hide in the dark. Oh God, I'm insecure. Oh no, I have these issues from my past. Everyone has issues. Okay. Finally, it's starting to get into the mainstream media. It's okay to not be okay. Some of us have been saying that for years, but it's good that it's now getting out into the media, where people are finally beginning to realize that there is nothing wrong. Hey, Angel, how are you? There's nothing wrong with talking about and having mental health issues. Nothing. Why? Everyone has a degree of mental illness. Everyone. Stop for a minute and ask yourself, who do you know that doesn't have issues? Who do you know that doesn't have something going on with them? So this is a time twice a week where we talk about our mental illness. We discuss ways to deal with it. If you're struggling with an addiction, hey Penny, how are you? If you're have something on your mind that's been troubling you for a while, if you want some advice on how to deal with a particular mental health issue you have. Remember, this isn't so much therapy that I'm doing, but this is me giving you an idea of, let's say you have an addiction to heroin, or you have an addiction to shopping, or you have a sex addiction, or you beat your child or whatever, and you want to get an idea of how something like that would be treated. Hit me up with a question, okay? because tonight is all about talking about what's on your mind. So let's get to a question I have on YouTube from CP. CP is asking me, I mean, isn't aggression a sign that a person can't deal with something in his life, something that's making him aggressive? Absolutely. Absolutely. Aggression can be a sign that somebody's overwhelmed. Anger can be a sign that there are issues going on within or without a person, within the person's mind or outside in their environment that they can't deal with, so that they get angry about it and they get frustrated by it. Absolutely. Aggression a lot of times is learned behavior. We learn to be aggressive, and people will say, well, we're born, it's wired into our DNA. We're animals. We that's what we do. Okay, maybe. But you know what? We also are wired for love and empathy and a whole bunch of positive emotions. So absolutely, aggression is something that that can be indicative that something is going on in someone's life that's making him aggressive. But the person who has the anger issues, and remember, you're never going to see or you shouldn't never see a course or somebody saying, anger elimination, I can eliminate your anger. It's always anger management. Why? Because anger is hardwired into us. Hey, Sarah, nice question. I'm going to get to that in a sec. It's hardwired into us. We have to deal with our negative emotions. You cannot eliminate it. You guys hear me once a live stream kind of talking about, came across another one today, these mental health influencers that are endorsed by Oprah or all these thought leaders. And when you try to find out like their about page, or there's nothing there. There's nothing there. And where are they getting their information? From people like us. They're coming onto these live streams, or they're reading psychology books, and now they're the thought leader in psychology. And people, you need to seriously question who you're listening to. If these thought leaders are so enlightened and they have all the answers, why do we have a society like we do? Why aren't we more enlightened? Why aren't we? Because people stigmatize their negative emotions. People don't talk about what's on their mind in what's troubling them. So CP from YouTube, I hope you're watching, or I'll shoot you a link. Yeah. Aggression is something that we all need to deal with within ourselves. Absolutely. We all need to deal with whatever aggressive thing that we're feeling and deal with it. Maybe whoever's aggressive needs to stop and say, let me think for a second. Why am I so angry? What is going on within me that is causing me to be so angry? And remember, people say anger, not people, but people in my field say anger is a secondary emotion. What does that mean? It's the primary emotion that usually drives anger is pain. And people don't like to admit they're in pain. So let me just go back up here and get to some comments. Kat is saying, hello, doctor. This is Amity. I don't think we've met yet. So anybody who is new to the broadcast, Kat has dissociative identity disorder, which used to be called multiple personality disorder, but it's usually fueled by trauma. And Kat has been open and talking about some of the trauma she endured. And for those of you who do not know, Kat's mother passed away recently, so she's been in the throes of a lot of negativity. Hey, Amity, how are you? So I said, hello, Kat is saying, again, I don't think I'll stay. All I wanted to come to say hello to everyone, had a completely shut down except me, and I'm getting to that point. Okay, well, and Kat or Amity, I hope you guys are all working with Kat to soothe her and help her through this, okay? Because there's a lot going on with Kat, and she needs you guys' help. Sarah's saying, as a healthcare provider, I believe that a significant amount of mental illness, in quotes, which is not really an illness, is more of an energetic disconnect between what we believe and what we do and what we think. Yeah, that's called cognitive dissonance. Absolutely. It started as children, and our internal GPS is attempting to self-control, but people don't understand how to decipher the feelings and emotions. Absolutely. I don't know, Sarah, I haven't seen you here before, so thank you for that question, because that's an awesome point. So again, remember, please share this. Please let people know you're on a mental health live stream talking to a licensed psychologist about things going on with mental illness. Please We need to engage more as a society about what's on our mind. Yes, absolutely. Absolutely. Mental illness is not really an illness, is more of an energetic disconnect between what we believe, what we do, and what we think. Absolutely. And a lot of times, Sarah, like you probably know, a lot of what we do, a lot of what we think, and a lot of what we believe, as you pointed out, is being affected by early childhood trauma, is being affected by stuff we're not working on. So we need to work on that. We need to figure out what is going on. Why is what I do and what I think and what I believe not connected? Why is that? And by the way, people, just to let you know, I am certainly not a believer that psychology is the answer to everything. Okay, I don't. I think it's a component of it, absolutely. Because whatever this thing, this brain, this thing in our heads is, which we still are trying to figure out, we don't really know. We don't even know. Like I happened to stumble upon a documentary last night on Amazon Prime, and it was about coincidental, it was about UFOs and all that. But they were interviewing people who were prominent people in the field of consciousness, and they were talking all about how, which I firmly believe, everything is connected to everything. Okay. Einstein proved that. He had this theory called spooky action at a distance. And what he found out, and he couldn't figure it out because it couldn't fit neatly into the box of physics, was that if you took a quantum particle and you joined it together with another quantum particle, or each particle was separated, they stayed connected. And if this one was moved, thousands, millions of miles away, the minute this one shifts. Now, why? What is that? They call it quantum entanglement. What is that? Why is it that what is this thing called consciousness? What is this universal field, the force? What is this thing that we're all living in? This is what we really need to begin to understand, is the interplay between our brain, our mind, our physical brain, and our thoughts, and whatever this thing around us is. So I don't really think that psychology is the answer to everything. I think psychology is the answer to a lot of things, because a lot of the way we look at the universe is going to be affected by how we were conditioned. So remember, conditioning is the early childhood experiences and lessons we learn that cause us to think and feel a certain way. And that is usually, not always, not everybody, but for many, many people, there's a lot of trauma and instability in our early childhood experiences. So we have expectations placed on us. We have a belief system imposed upon us. We have a religious dogma imposed upon us. And that then affects how we view the world. So if I have a whole bunch of unhealed emotional wounds, you can bet I'm going to have my worldview, my view of how people affect each other or interact with each other, or even my view of people, is going to be affected by that, by those emotional wounds. So Sarah's point is spot on, because what she's saying is it started as children, and our internal GPS is attempting to self-correct, but people don't understand how to decipher the feelings and emotions. Exactly, Sarah. But Sarah, I'll ask you, why don't people understand or how to decipher the feelings and emotions? Why do you think that people don't? Yeah, Irene, I haven't forgotten about you. I'm going to get to your question. You're on my list of questions that I'm going to get to. I just saw I didn't read your other question, Irene, but thanks for logging on. Why don't we know how to understand and decipher our feelings and emotions? Why? Because that's not a priority. We don't teach that to kids early on. No one taught me. I often comment to my 5-year-old son, I keep reminding him that he's getting lessons that I wish I had gotten when I was 5. I banged my knee on the side of our bed today, and it hurt like a mother, you know what? And I'm in pain, and my son starts saying to me, "You can handle the pain, Papa." Remember that? You can handle the pain, and then he tells me, "Say that. Say you can handle the pain." And the laughter between my wife and I literally made the pain go away. But we don't, the reason people don't understand how to decipher their feelings and emotions is because we don't live in a culture where people talk about it. We don't encourage children early on to talk about how they're thinking and feeling. We don't model that. Our kids, I never saw that. I've talked about my childhood. I never saw parents, well, honey, I want to talk to you about how you're feeling tonight. I didn't get that. I got just the opposite of that. My father would come home, put his earplugs in, and that was it. That's a lot of how we grew up. It wasn't all bad, but there wasn't a, hey, what's on everybody's mind? How things going? Or is there something you're struggling with? Are you angry at us? Are you holding on to resentment? Like one of the things I'm teaching my 5-year-old now, and since he's been 4 and talking, is how to manage anger, how to let go of anger, how not to hold on to anger. And he's getting really good at it, to the point now where he's coaching me. But so yeah, absolutely. People need to understand how to decipher their feelings and emotions more. Absolutely. So before I get to Irene's next question, I want to get to Irene's first question that she posted a couple of days ago. She asked a series of questions, and Irene, I'm not unfortunately going to get to each one, but the main one I'm going to deal with is, how do you deal with post-narcissistic negativity and abuse? Excellent question. How to deal, and then she asked, how do you deal with a partner that avoids a disagreement by circling in and off topic, an argument, and then escalates the answer? And then she said, I've dealt with people, narcissistic personality disorder and borderline sociopaths and family, and most of my relationships, I'm done with dealing with the negativity. Absolutely. Well, you know what, sister? Sometimes you got to draw boundaries, and sometimes you do. Sometimes, if your family is causing you nonstop negativity and no one's owning their crap, and it's all you're the problem. Sometimes you got to do what you got to do to protect yourself. How do you deal with post-narcissistic negativity and abuse? So I'm going to assume what you're saying, let me just read your other question here real quick. Hi, I'm in my late adulthood, discovered that I am codependent, and I'm working on that, but I have also discovered that my mother was a narcissist. This is the same person who asked the question a couple nights ago. No, Irene. Hey, Irene. But I also have discovered that my mother was a narcissist, and so all my relationships have been with narcissistic personality disordered people. I'm trying to recover from a 10-year abusive relationship, and I don't know how to get past the pain, and I'm overwhelmed with replays of my past. Okay, so yeah, that's what I was going to assume, Irene, that when you say how do you deal with post-narcissistic negativity and abuse, that you're talking about how do you deal with it after you're out of the relationship and it's still affecting you. Well, my sister from another mister, you know what I'm going to say. You're new to this live stream, but you got to talk that, I would say, SH out, but my son's sitting right here. You got to talk that out. You got to talk things out of you, Irene. You got to deal with the pain. You got to work on it with somebody who can help you navigate through all of that pain and all of that abuse. Because if you don't, it's going to sit in your mind as trauma, as wounds. Literally, like if I had a cut on my hand, I don't know if you guys remember, I used to have this big blood blister on my hand. My one attempt at home improvement led to me, smashing my hand. But anyway, it's all gone. Why? Because I treated it. I cleaned it up. I got the blood out. I debrided the wound. And then I put a Band-Aid over it. And guess what? Nothing now. And it was huge. It was like the size of this. Well, can I draw backwards? But anyway, that's what you have to do with your emotional wounds, Irene. I don't know if you're in therapy. I don't know if you've done any work on yourself, but you have to work on that trauma. There's no podcast. There's no book. There's no thing that's going to cure you of it. Now, all of those are good links in the chain, but until you clean out that emotional wound by talking things out with somebody who's trained and licensed and has experience working with negative emotion, trauma, and pain, it's going to sit in you and affect you. It's going to affect your hope, meaning you're going to think, I'm never going to, everyone's narcissistic, everyone. And the reality of it is everyone's narcissistic to a degree. Absolutely. Absolutely, everyone is narcissistic to a degree. Now, does everyone qualify for narcissistic personality disorder? No, but everyone has a degree of mental illness. Everybody. If you picked up the DSM and the diagnostic book on mental disorders, and you just started reading through that, you'd be like, yeah, I got a little of that. Yeah, I got some of that. Oh, no, yeah. Mm-hmm. The key is whether or not it causes clinically significant impairment or distress. But that is something that can be diagnosed by a professional who's trained in mental illness, not a general practitioner, not a psychiatrist. Geez, man, I had a conversation with a colleague of mine yesterday at the park who's struggling with his son, and the amount of adult medication they have this poor kid on, I don't even want to get to that whole psychiatric meds, because I'm not saying they're all bad. But anyway, Irene, the point is, if you were in a 10-year abusive relationship, sister, and you don't know how to get past the pain, and I'm overwhelmed by replays of my past, sister, that's a degree of post-traumatic stress disorder. Now, I'm not saying you have PTSD with the D, but you have the PTS, you have post-traumatic stress that needs to be talked out and dealt with. It is not as scary as you think it is, Irene. It's not. It's painful and it's difficult in the beginning, but what happens is, as you begin exposing yourself more, as you begin to be exposed to those memories and you're processing them out, the dust starts to settle. Healing starts to happen because you're working on it. You're treating it. This is what happens with people. Irene, I don't know. Again, Irene, I don't know if you're still on. So Irene, if you're still on, if you could just update, just say, answer one question. Have you worked on any of this? That would be my question to you. Have you worked on any of the 10-year abusive relationship? And you said something interesting, and I'm going to touch on something real quick here. You said that, where did you say that? Oh, I discovered that I'm codependent. Okay, now let's talk about this whole idea of codependency, because let me see if she's following up. Yes, I'm here. Okay, so my question is, on my own, yes. Okay, Irene, with all due respect, my sister, and I call everyone brother and sister. I'm sorry. If you're my patient or client, you hear me saying that all the time. Why? I honestly believe we're all connected, so it's just my way of doing that. If it offends you, I'm sorry. But anyway, so Irene, good that you're working on it on your own, okay? You need help, okay? You got to get some help with it. And when I say you got to get help, there's nothing wrong with that. Irene, if you go to a dentist, if you go to a cardiologist, if you go to any other gist, there's nothing wrong with going to a psychologist or a counselor or somebody trained and licensed in the field. There is nothing wrong with it, Irene. The only reason you're not doing it, I don't know if it's cost or whatever, but it's probably because of that stigma, that ridiculous mental health stigma that has been perpetuated to the point where we have good, decent people like Irene who are spending their days in pain when there's relief. There's relief. Irene, I don't know if you know this, but the efficacy rate of psychotherapy is 70, and in some studies as high as 30%. Okay? 70 to 80%. Did I say 70 or 30? I don't know. I'm sorry. This is live. I make mistakes. What can I tell you? 70 to 80% of people who go through psychotherapy go through some sort of therapy with a trained, licensed individual, not a thought leader who's telling you how to stop procrastinating and how to be a better person, and all good advice, but it only deals with 1/3 of the issue. You know, positivity is great. Yeah, let's all be positive. Let's talk about our negativity a little bit. Let's work on our negativity. Let's work on the other energies. But anyway, back to Irene. Sorry. The only thing holding you back, Irene, is probably shame. You're probably ashamed that you're still hurting. You're probably dealing with guilt of being in an abusive relationship. And I was going to say real quick about this comment you made about that you're codependent. Now let's talk about the difference between codependency and dependency. Okay. Most people mistake dependency, being dependent, with being codependent. So real quick, just the Reader's Digest abridged version of the differences. Codependency originally came out of the addiction treatment literature and vernaculars and discussions about codependency. Codependency is when a partner, a mother, a father, somebody you're in an intimate relationship has an addiction, has some sort of negative mental illness condition, and you become dependent on being the provider, the care provider. Codependency is the person who is got the illness. You almost need their illness to get meaning from. That's what codependency is. You have an addiction, and maybe they have an addiction, and you both are addicted to each other's addiction. That's just a very general, before everyone's like, that's not what codependency. That's a general idea of what the classic definition of codependency is. Dependency is maybe you're too dependent. Maybe you become too dependent on people. And let me give you my 25-year opinion on dependency in a relationship. Okay, you ready? You ready for this? It's okay. It's okay to be dependent on somebody to a degree when you're in a relationship. There's nothing wrong with that. There's nothing wrong with being dependent on somebody when you're in a relationship. Okay? Nothing at all. Dependency is healthy to a degree. We're dependent on food. This camera's reversed. We're dependent on water. We're dependent on air. To a large degree, we're dependent on sunlight to live. Guess what else it's okay to be dependent on to a degree? Love, caring, somebody wanting to be with somebody, getting a certain degree of meaning out of your relationships with people. There's nothing wrong with that. I tell my son all the time, I need your love. I need you. I tell my wife the same thing. That doesn't mean, I'm going to take it to the degree when he gets older. No, you can't leave me. No, that's too dependent. So maybe, Irene, you need to look at maybe you're too dependent. And yes, I know you're scared. And thanks, Sam, for posting the link to the Psychology Today therapist. I believe I posted that. So yes, absolutely. That's a great resource for you, Irene. And it's okay that you're scared. One of the main things you have to tell yourself, sister, is it's okay that I'm scared. You can't hate yourself you can do whatever you want. You can hate yourself as much as you want. But Irene has to say to herself tonight, it's okay that I'm scared. It's okay that I'm still injured. So she's following up saying, I fear I don't know anything about these types of relationships. And you know what, Irene? That's not your fault. Remember, that's not your fault. You're new here, so you haven't heard me say this before, but you didn't ask for this abuse. You didn't ask to grow up with a narcissistic mother. You didn't ask for any of this. So you have to start taking it easy on Irene. You have to, as I've said many times on this broadcast, you have to work on Irene's relationship with Irene. That's the first relationship you need to work on, and it can start tonight. I didn't say end. I didn't say cured. I'm not one of these arrogant YouTubers who thinks you're going to watch my live stream or video and you're going to be magically cured and just, no, it takes work. And if you've gone through, you have a degree of trauma there, Irene. And if you've gone through what I think you've gone through, which could have been physical abuse, sexual abuse, psychological and emotional abuse, if you're involved with narcissists, absolutely. But you have to work on that pain. Okay, you have to. Ursi is saying the healing process is beautiful, but very painful. Yes, it's very painful, Ursi, but it's more painful in the beginning. It levels out because we get used to things and we start acclimating to it and we begin processing it depending on who we're working with. And no, yes, Sam saying little steps, Irene. Irene has to love Irene. Yeah, well, that's the end game, Samantha. But the first part of that is Irene needs to get to know Irene. Irene needs to go through a process of self-awareness and self-acceptance, and then that can lead into other forms. But yeah, there's a process, Irene, that no problem. You're welcome. I'm glad to hear that's what you've been trying to do. But Irene, the main thing I want you, and I'm going to get to some of the other questions, was focusing on Irene for a minute. The main thing I want you to do tonight after this live stream, Irene, is I want you to go into the mirror and I want you to just look at yourself in the mirror and I want you to say this to yourself. It's okay. It's okay that I'm in pain. It's okay that I'm still being affected by this abuse. I didn't ask for this abuse. I didn't ask for it. Now, when I say it's okay, I don't mean it's okay and I'm going to stay in pain. I mean, we're going to stop hating Irene for being in pain, and then we're going to say it's okay and I'm going to start working on it. Because you can work on it, sister. You can work on it. This is what people don't understand. This mental health stigma is so insidious that it has convinced people that they have to stay in, that there's no hope. There's no hope to work through this painful stuff that we've been carrying around. And that is the most damaging part of this stigma, is that people are not getting the help. It's like, imagine if there was a dental health stigma. Oh, you don't go to a dentist. No. Or let's say there was a cardio heart stigma. Oh, no. You got heart pain. Physical, not heart as an emotion, but heart. Oh, no. It's shameful to go to a cardiologist. Nope. Or let's say there was a stigma against cancer. Oh, no. Go to an oncologist. No. Okay. And that's all I'm asking you, Irene, is to say to yourself, I can do this. And yes, like Ursi said about the healing process, in the beginning, it can be painful because you're facing things that you've never faced before. And that process can be painful. Excuse me. So what I encourage everyone to do is to start mentally prepping like an athlete. I do a lot of sports psychology with athletes, a lot of former athletes. But one of the things I work with athletes is getting their game on, so to speak. And one important part of that is beginning to tell yourself prior to the game, I can deal with this. You start visualizing yourself in the game. So Irene, what I would encourage you to do is start talking to yourself in a soothing, compassionate way. I can do this. It's okay. I didn't ask for this pain. It can heal. I can heal. I believe I can work on this. This is what we need to work on. Okay, Irene. Obviously, something drew you to these live streams, or you saw it on Facebook or whatever. Look, people, I know this is going to sound bizarre as a licensed psychologist, but I absolutely believe in the years and years of doing this, we are in some sort of healing something. I don't know what it is. Some Christians call it the body of Christ. They're all kinds of metaphors for us actually being inside of something. I see too many examples on our planet, how our planet self-heals, how we have these systems that keep our body, we get cuts. It's not like that huge cut I had on my hand is still there. And yes, some people have compromised immune responses. I get that. But in general, I firmly believe we are in something that is trying to help us heal. And I know that sounds whatever, but I firmly believe in that we are all capable of healing more. And I'm about to come out with something about how healing is affected by emotional wounds. So stay tuned to that. So let's see who else is asking questions here. So big Texas prayers for Kat. Thanks, Sam. Hope you got your water and power back on, Samantha. Our COVID antibodies are high enough to travel extremely carefully. So we leave for the funeral a couple of days. Beautiful, Kat. Excellent. I think when we said Amity, great. You can handle this, Kat. If you can hear me in there, you can handle this. You can deal with this. Go make peace. Go say goodbye to your mom. You can do this. Okay. Excellent. Keep going. Let's see, Irene. I got to Irene. Irene, keep asking questions, please. Bracy is saying, I cannot get the meds I need for my anxiety. Well, Bracy, have you worked on what's causing the anxiety? I'm not saying get off the anxiety meds, but have you thought about combining therapy with the anxiety? Why am I so anxious? What is feeding my anxiety? Am I anxious about being depressed? Am I depressed about being anxious? Do I have unhealed emotional wounds from my past that are causing me to be anxious? Why am I so scared? What's going on with my anxiety? I don't know if you've ever tried to work on it, but combining medication with treatment is called best practice. That is where you get the highest, the best results. Okay. If you need medication, that is. Some people don't need medication. I had a call from a person today who's been on Paxil for, I don't know, however many years. Their general practitioner told them to get on it and that you're never going to get off it. Ridiculous. Next time you're at your general practitioner's office and they prescribe a mental health medication to you, ask them what their mental health training is. Just ask them, okay, well, you're wanting me to get on this mental health medication. What's your mental health? Why are you prescribing mental health medication to me? Are you trained in mental health? Should I be talking to a psychologist? Can you refer me? I don't want to just be on meds. Question why they're doing that. You do not take medication with this belief in your mind that you're going to be on it the rest of your life, especially psychotropic medication, because there is no evidence, no longitudinal studies showing that people have to stay on these medications the rest of their life. None. Okay. Now, I'm not saying severe psychiatric conditions. 6 to 8% of the population has organic brain anomalies it calls schizophrenia, all these severe mental illnesses that need that 6 to 8%. That's not everybody. Okay. So Bracy, follow up with me. What are you anxious about? Okay. Tweet Robinson is saying, I haven't been feeling like myself. I spoke to my doc. She as much poo-pooed me, and their doctors over at the local hospital keep canceling my appointments. Sorry to hear that. I'm not able to think or remember so much. I'm hurting and tired emotionally. Well, what's going on, Tweet? Like, what is going on? When you say you haven't been feeling like yourself, what is it? Is it the COVID? Is it this pandemic that we're all living under, hopefully there's a light at the end of the tunnel? Like, when you say you're not feeling like yourself, what is affecting you? I'm not able to think or remember so much. I don't know how old you are. I don't know if you're getting older and it could be age related. I don't know if you've had some sort of blow to your head, a TBI, a traumatic brain injury. But when you say I'm hurting and I'm tired emotionally, I feel you. I feel you. When we're hurting, when we're in pain, I mean, this is why painkillers proliferated throughout our culture, our society, because people hate pain, and pain can make us think, oh God, there's something. And pain has a way of convincing us that there's something really wrong with us. And when it's emotional or psychological pain and we don't have the ability to work that out or talk that out, we do start believing that it's only going to get worse. And I get tired. You're tired emotionally. You don't want to deal with things. So I feel you, Tweet, but you got to work on that. You got to start figuring that out. You know, most people like myself, I've converted my practice to 100% video online. That's one of the, I hate to say one of the what's it called? Silver linings to this whole pandemic is that I get to work from home, and I am not going back to in-person sessions anytime soon because I love not having to commute. And so there are plenty of people like me that you can engage with online. People think, well, how effective is the online? It is as effective as this right now. And it's even more effective because we are talking, we are engaging with each other about what's going on. And it's not so much about the visual. That's part of it, but it's more about the psychological and the feedback you're getting. So Tweet, give it a shot, sister. Okay. Give it a shot. Kat saying, my upbringing was very religious, and mental illness was extremely taboo. I never spoke about it outside my medical team. It wasn't until 6 years ago when I discovered and became a Norse pagan. Okay, I don't know anything about that. So let's fill me in on Norse paganism, that I started opening up and discussing my past and my experiences. Social pressure affects us more than we know and understand. Absolutely. Absolutely. But social pressure only affects us if we're letting it affect us and if we're not questioning it. And yes, do I believe culture has a dark side? Absolutely. We need to question, wait a minute. So I'm taught that all Jews suck because I'm a Muslim, or I'm taught all Muslims suck because I'm a Jew. I might want to look at that, or any other learned behavior that we're taught. So, thanks, Kat, and keep working on it, Kat, because not yet, buddy. You need to work on integrating all those personalities into you, and you being the hub of the wheel, Kat. That's what we're moving towards. Okay. So great. Let's see. On my own, yes, Bracy is saying, how do you get diagnosed with PTSD without a prior diagnosis? Easily. not easily get diagnosed, but you call a psychologist or a psychiatrist who does assessments, and they'll do a mental health assessment on you. You don't need a prior diagnosis. Post-traumatic stress disorder doesn't require any, you can walk off, you can make an appointment, you can discuss this with a, sorry to my physician friends, but okay, baby, I'll be done in a sec, buddy. Just chill out. Don't go to a general practitioner or a medical doctor and get diagnosed. Get somebody in the mental health field. Find a psychiatrist or a psychologist who does assessments. I don't do assessments. I do all treatment. I focused on delivering therapy. I actually picked a program that was concentrating on therapy. But yeah, you don't need any prior diagnosis. You call up a psychologist who does assessments, and they'll put you through some tests and ask you some questions and do a mental health history on you, a clinical interview and all that. And if they feel you have symptoms that rise to the level of PTSD, they'll diagnose you. Okay. So, but that doesn't mean you have to stick with that diagnosis. Okay, Bracy? Just because you have PTSD, that's not like, you have PTSD the rest of your life. You can work on the trauma, post-traumatic, the after effects of the trauma. And, Bracy, a lot of people don't know, and I've talked about this before, on one end of the spectrum is, sorry, I'm getting this notification. I don't know. On one end of the spectrum is PTSD, and on the other end of the spectrum is PTG. What's PTG? Post-traumatic growth. You can grow from the trauma if you work on it. Look it up. Type in post-traumatic growth and read some of the literature, some of that on there, on some of the case histories, some people's stories. Post-traumatic growth is the offshoot of post-traumatic stress disorder, but it takes work, people. It takes work. And this whole let it go society and be your best self and all this is just masking the work that needs to be done. So you need to get in there and do the work, okay? Irene's asking, are there professionals who specialize in this type of abuse? Absolutely. And they don't need to specialize it. If they have like I have 20, I'm coming up on 25 years in the field. I've worked with so many different patients in so many different clinical settings that we get so much exposure to this that we have experience basically in dealing with this, because it's not as difficult as you think to help someone deal with trauma when you've worked with it a long time. So you can interview them, Irene, ask somebody, find somebody in your area, maybe call, I don't know what health plan you have, but call your healthcare provider and tell them what's going on, and they'll help you find somebody. They'll do a lot of the work for you. If you don't want to go through health insurance and you have a budget, it can be, it's not cheap. Unfortunately, our hourly rate can be, but don't pay more than $150 an hour, because there's plenty of people who will do it for less. Okay. If you don't want to get somebody with a doctoral degree, there are many very talented licensed clinical social workers. They have master's degrees. They're licensed professional counselors. The key is the first word that I just said, licensed. Okay. Licensed. But yes, there are a lot of people out there that can help you with this, Irene. Don't give up, sister, please. Let's see here. Bless you, Bubba. Let's see. Ursi is saying, I agree with you, doctor. Great. We made it through. Okay, great, Sam. Glad you made it through. Let's see. Bracy's saying they always offer antidepressants. I don't want these. I hear you. Yeah, she's saying life, homeschooling, pressure from husband, severe brain fog. So you brain fog? Did you get COVID at some point? You might, I don't know if you're exposed to COVID, but brain fog is definitely part of it. Damn, I'm late. Sup, everybody. Hey, what's up, Juan? It's okay, man. You're here now. What's going on? Let us know. Did you talk to your sister about all that, or your brother and the kids and all that? Fill us in. But yeah. So, but you're right, Bracy. They do. Doctors default to medication, and I'm not saying that they're bad or they're wrong, but they do what they're trained to do. And they're trained to throw medication at things. And I'm not saying all medication's bad. I'm not saying that. medication, and I've always said this, is like, when I was a kid, I broke this arm, and the bone shot out, and it was just traumatizing as a kid. And my arm fell out of a tree, showing off for girls, believe it or not. Anyway, so imagine if the doctor, after he set my arm and they couldn't put me to sleep and had to yank it, and anyway, suppose I go and I got the cast on, and I go into his office, and he says, or she says, "Well, Stevie boy," I was like, I think 10 or 8 or something like that, "you're going to have that cast the rest of your life." Imagine if they said that to me. What would my arm look like right now if this was in a cast since for the last 38 years? 38? I don't know. 48. Yeah. Anyway, you can imagine my arm would be atrophied, but that is what a lot of these practitioners are doing. And I'm not putting them down, but I plead with them. Please don't tell your patients you're going to be on this the rest of your life, because you come, a medical doctor, somebody in our field has power. People look at us like, oh my God, their opinion of me. Please stop telling patients they're going to be on antidepressants the rest of your life. There's no evidence to suggest that has to be. There's no longitudinal studies showing that is the way these medications were designed for. Combine the antidepressant like a cast. I'm going to take a low dose antidepressant. I'm going to work through what I'm depressed and anxious and what I'm feeling about. And you watch what happens. Okay? Watch what happens. All right, let's see. Sorry, I get worked up by all this. My mother's death is extremely debilitating. Wow. Okay, well, that's definitely I know it sounds like you guys were close, so that's definitely going to affect you, the loss of your mom. Absolutely. So you got to work through that trauma. You got to work through that loss. You got to do some grief work. Okay. And that takes talking it out, venting, crying, being in a therapeutic environment where you can fall apart and come back together, That's how we heal. But people, pain stigmatizing society we live in, kill the pain, not making fun of you. Kill the pain, I don't know if you have any other medical conditions. Let me scroll down here. Oh, okay, hypothyroid. Okay, so, well, if you've had thyroid issues and you're hypo, meaning that you have no energy, sleep, lethargy, as opposed to hyperthyroidism where your heart's, that's going to need some medication, absolutely. So you got a lot on your plate, Bracy, but, you got to start working through that, okay? You got to start working through that. Hey, Angie. Angie's saying, I've been feeling really annoyed with people. This is not usual for me. I don't like feeling this way. I don't like being annoyed with my kids for bugging me over something and over having to do extra work to help someone out. I would imagine whoever you're needing to help out, you may feel you don't deserve it. But Angie, yeah, if you're feeling annoyed with people, I would imagine, and again, I can't say this as an absolute, but I would imagine maybe if you're feeling annoyed with people, it's a projection. Maybe you're feeling annoyed with yourself. Maybe you're really getting down on yourself, falling into that self-hate. So Angie, we need to get back into talking some of that out and working through those feelings, but you have to make them okay. You have to say to Angie, it's okay that I've been annoyed with people. It's unusual for me. I'm not crazy about feeling like this, but I got to figure out why. And, Angie has shared a lot of information with us on our live streams about some of her problems with her marriage, one of her kids and some of her kids. There's some behavioral issues there. So you got a lot on your plate. This is the time to say to Angie, it's okay that I'm going through this. You just had some legal issues, but I got to figure out why I'm getting annoyed with people. What is it about people that is causing me to be annoyed? And you got to start working through those negative emotions. But the key, Angie, again, is not hating Angie for feeling this way, not hating her for feeling down or bad about herself. Okay. So we got to keep working on it. And yeah, as far as when you say having to do extra work to help someone out, again, maybe you feel that person doesn't deserve the extra help, and maybe you're resentful because they don't help you enough. And that's something to work on. So let me just see here. I don't think I'm going to be able to get to everybody or see, did I touch on everyone's? Okay. Last question will be Juan. Juan is saying, Juan, my brother, Are you concerned about your son's social activity during the pandemic, Doc? What are you doing to remedy? Do you see any clinginess? First off, dude, don't ask about my personal life. My son, no, I'm just joking. Am I concerned about my son's social activity? Yeah, we are. I am, luckily for him, I'm the kind of dad, the kind of father who loves being at home. And I know it sounds bad, but I generally put my wife and my son as my priority. So we spend a lot of time together. I'm able to work from home, so we take breaks and have do hide and seek, and we talk and we dance and we do crazy things and we go outside. So I'm trying to do what I can to do what I can socially for him. But yeah, we do. We have neighbors who, their two little girls love him so much, and it's so hard. You want to hang out, and then so we're trying to let him know that it's coming to an end. He's going back to school in August. We've decided on that because he needs to. He's smart and he needs to be challenged. What are you doing to remedy? I just talked to you about that. Do you see any clinginess? Yeah, we cling to each other a lot, but we work with him. He had a mini meltdown today when my wife had to go. She's trying to get her master's degree, and so he had a mini meltdown today, and I had to take some time to work him through that. And he calmed down, and he's learning how to regulate and manage his negative emotions really well because I'm talking to him. I'm working him through it. I'm giving him what I never got growing up, which is somebody who is helping him understand how important it is for him to talk about how he feels. And at an early age, learn how to let go of negativity. Now, I don't mean let go, like the let it go crowd of, oh, you were abused when you were a kid, just let it go. Or I'm hurting you and I'm just telling you to let it go. And that's not what I'm talking about. I'm talking about at a low level, learning how to let go of anger and not hold on to it. And he's learning all of that now. So great questions, man. I have no problem with self-disclosure. If you ever work with me, you know that. Samantha is saying, how do you help a friend who does not know that they need help with depression? Great question. How do you help a friend who does not know they need help with depression? You keep talking to them. You keep asking them about their depression. You keep encouraging them to look at how their depression is affecting their world around them. You maybe talk about your depression, how depression affects you. You talk about a friend of yours who got help with their depression. You ask them, are you not accusationally, but are you aware of that you tend to be kind of down? And I'm not saying that perfectly, but try to raise their awareness. I call it, but we call it stimulus value. Talk to them about what they stimulate in you. Ask them if they're aware that they do, maybe that some things from their past are affecting them. But the key is empathy. Empathize, feel them, let them feel you feeling for them. Come at them with that. I'm really worried about you. If it's a woman, I love you. If it's a man, a friend, try to find a way to make them feel that you're concerned. And talk to them about your own depression. Have a conversation about depression. You start. Share with your depression. I've been very open and honest how back in my early mid to late 20s, I went through a real dark period where I had suicidal thoughts and started feeling like, what is the point? Why I went through a really bad breakup after I had given away everything I owned to start my life over. The person who I moved away, moved back down to from the Caribbean, and we went back down there to kind of regroup. And she ended up leaving me for somebody, a person who I got her a job with. It's a whole long story, but I went through a very dark period, and a lot of that was the genesis for me beginning to really look at why was this affecting me so much. So out of that post-traumatic stress came post-traumatic growth, because I honestly don't feel that I would be here right now had I not gone through a lot of the pain I went through. So talk about depression as a topic, okay? Let's see. I don't feel, Bracey's saying, I don't feel depression. It's anxiety and overwhelming feelings. Well, you got to work on them, because I guarantee you depression and anxiety tend to go, it's called comorbid, meaning they co-occur, they occur together. Most people are anxious about being depressed, and they're depressed about being anxious. And kind of like feeds off each other. So let's see here. The hardest thing I've ever done is thrown into, yeah, I hear ya. My mom is in hospice, Ursi is saying, and a tree fell on my 26-year-old son while on base, and he's currently paralyzed. Oh my God. But I just know he will walk, and just as he did before. Wow, Ursi, I think I think I remember you from a previous broadcast, you talking about this. Wow. That's a lot of trauma to deal with, sister. That's a lot of trauma. So our heart goes out to you, but you gotta get some work on Ursi. You gotta talk on how all this is affecting you. Got to talk that out. Okay. Juan is saying we are trying hard to in the same situation, Doc. It's great benefit for him to have dad at home. Dad usually at work these days. Exactly. Penny saying thanks, Doc. Sure. Samantha is saying she is starting to not care about things she used to. She has me worried. Tell her, honey, I noticed you're not caring about things you used to. I'm worried about you. How do we get you some help? Can I help you get some help? Tell her about that Psychology Today link. Tell her there's nothing to be ashamed of. Everybody goes through. Yeah, I remember you, Ursi. Everyone has these dark thoughts, these negative times. I don't know if she's gone through some loss or trauma, or if it's just this incredible year of madness that we've all been dealing with, that hopefully is coming to an end. And, you know, Sam, I know you said you're from Texas. Please keep wearing your mask. I don't want to get into the political debate about that. I know Texas just lifted their mask. Please, Sam, protect yourself, protect people around you. But anyway, people wonder, you know, the masks don't work. Why is there no flu this year? You know, why is there no flu? Why? Because masks and social distancing works. That's why. Okay. Why is there no flu? Remember at the beginning, good, Sam. Remember at the beginning of the year when this whole pandemic started, they were saying masks don't help. And why is there no flu, people? Okay, why? Why is there no flu? If I drop my phone one more time, anyway, why is there no flu this year? Because masks and social distancing works. So if you're in a state without a mask mandate, please be careful, because we ain't out of the woods yet. All right. All right, people. Well, I got a good guest coming on next week. We're going to talk about all kinds of issues relating to having kids at home, and techniques and tools, and her experience as a mental health practitioner. So tune in for that. I think it's going to be Thursday night, and I'll post something about it on the Facebook or YouTube page. So again, great lively discussion tonight. This is why sometimes I like to just keep it open and just talk about what's on everyone's mind. And I did put minds that's not a typo, what's on your minds, because I believe we have, not only I'm talking about the plurality of minds, but we have many minds. We're not just one unified mind. Whole nother conversation. So thank you for all your engagement. I appreciate you guys logging on and engaging with me. And remember, last bit of advice, if you're struggling with any kind of mental illness, please work on it. Okay. Please, Irene, please, anyone struggling with pain from their past, issues that still affect them, any degree of mental illness, please work on it. You can heal. Don't buy into the belief that you cannot heal. Remember the placebo effect. Believing that a sugar pill is your medication a lot of times affects you. You start responding to the sugar pill like it's a medication. The nocebo effect. People tell you, oh, this is just a sugar pill, and these are studies. The medication stops working. Okay, please, people, don't believe you are broken for life. Don't believe that you have to suffer in silence the rest of your life. There are proven treatments out there that can affect healing, within you. These emotional wounds can heal. Okay? Don't give up. Please don't buy into the idea that you're broken for life. And please get some help if you need it. Okay? Shoot me some messages. I try to respond to people if I can. A lot of the questions I get sometimes are very deep, so I can't go back and forth. So I'll answer them live. Okay. All right, guys, have a good weekend. Did you want to say goodnight? No? All right, come say goodnight real quick. Come. Quick. Everyone's got to go to bed. Here's the man himself. What did you tell me tonight when I stubbed my knee? What did you tell me? What did you tell me I can handle?
Handle the pain.
I can handle the pain, exactly. And we got to start believing that. Okay, everybody, we can handle the pain and we can heal. All right, say good night.
Night.
Night, everybody. See you next weekend.